Hello and welcome back. Welcome to my YouTube channel at Doctor on Wheels, and I'm here to bring you trusted health information wherever you are. You can follow us for simple, updated, practical, and reliable medical insights to keep you and your family healthy. You can subscribe to our YouTube channel at Doctor on Wheels. You can also follow us on our social media platforms at Zawadi Premier Hospital _ Gong for our Instagram and Zawadi Premier Hospital Gong for our Facebook page. Now, today I want us to discuss a very important topic that you guys have requested me to discuss. That is diabetes mellitus. So, before we dive into today's topic, I want us to listen to some words of wisdom. And words of wisdom today comes from the book of Ephesians, chapter 4, verse 32. And the Bible says, "Be kind to one another, be tender-hearted, forgiving one another as God in Christ forgave you." So, today you can make it your ambition to be kind to someone today and lighten the day for someone. So let us dive into today's topic. Have you ever had episodes of excessive and frequent urination? Okay, or excessive thirst? You just feel like you want to take in, you want to drink water every now and then, or an extremely abnormal excessive hunger. You've just taken food 2 hours down the line, you still feel so hungry and you still want to take food. Or you have had unexplained weight loss. You cannot explain how you lost several kgs. Or unexplained fatigue. You just wake up in the morning and your body is just so weak. You just don't want to do anything. You do something small and you just feel so tired. Or you've had episodes of blurring of vision, okay, or recurrent infection. You've been to the hospital every now and then. There's this kind of a infection that is being treated, and after treatment, 2 weeks down the line, you're still running the same infection. Or you have had a wound, probably especially on the legs, okay, and this wound has taken a lot of time before it heals, okay, or you have had any of these episodes or these symptoms, either you or even your loved one. Okay, these ones might only be the signs that someone or symptoms someone might be presenting as a result of diabetes. So I want us to dive into diabetes and basically look at what causes diabetes, okay? How can you identify it and how can you manage and how can you prevent? So diabetes has been a global epidemic whereby millions of people have been affected globally, okay? And it has been reported to have very high morbidity and mortality. So morbidity basically means that many people have fallen sick because of diabetes, and many people have developed complications as a result of diabetes that have led to their death. Okay, now diabetes has been linked to mostly lifestyle diseases, okay, or lifestyle. So we'll be looking at that as one of the risk factors. And prevention, okay, early diagnosis, identifying diabetes early enough and treating it early enough can actually prevent the complications that come with diabetes, and therefore you can reduce the mortality and morbidity that comes with diabetes. So by far, what is diabetes? Diabetes is a chronic metabolic disorder with elevated blood glucose. So it's a metabolic disorder. It's a disorder of metabolism that results into elevated glucose level. So your blood glucose level is high, okay, or is always elevated as a result of a metabolic disorder. Now, this metabolic disorder is as a result of insulin. So the problem here is insulin. Okay, so number one, you can either have deficiency of insulin or reduced insulin production, or you can have inability of the cells to respond to insulin, what we call insulin resistance, or you can actually have both. Okay, and that basically will form the basis of the types of diabetes that we discuss. So number one, you can have type 1 diabetes. So type 1 diabetes is when you have deficiency of insulin, and this is as a result of destruction of the cells in the pancreas called the beta cells that are responsible for production of insulin. So you end up with deficiency. And then type 2 diabetes is when you are producing insulin, but the cells are not very responsive, so they are resistant. Okay, so they resist insulin, or you can actually be producing insulin, but then the insulin is not enough. Okay, and then the other type of diabetes, gestational diabetes. So gestational diabetes is basically glucose intolerance during pregnancy. So you have this type of glucose intolerance that starts especially during the time when you're pregnant. And then we have another type of diabetes called diabetes insipidus. So diabetes insipidus mostly is a result of deficiency of antidiuretic hormone. Now, antidiuretic hormone basically helps to prevent you from losing a lot of water. Okay, so when you have deficiency of that hormone, it means you lose a lot of water through the urine, and therefore you will end up with hyperconcentration, okay, or hyperosmolar. Also, basically, you will be dehydrated, and then the sugars basically, so the concentration of the sugar will be high, not because you have diabetes per se, but it's because of the dehydration. And then we have other types of diabetes, okay, like diabetes as a result of genetics. So someone is just being born without a pancreas, okay, or pancreatic diseases, okay, that can actually lead to diabetes. And then we have some other endocrinopathies, okay, but also we have other diabetes as a result of drug induced. So you use some drugs, specific drugs that basically can induce diabetes. Like for example, people who use steroids for quite a long time as a result of a certain disease, okay. So use of steroids for quite a long time can actually induce diabetes. Now, who are the people who are at risk? Number one are family history. So if you have had a close family member, either a close family member or a relative who has had diabetes, okay, then you are at an increased risk of developing diabetes. Number two is obesity, okay, BMI of more than 30, okay, it's a risk of development of diabetes. And then physical inactivity and sedentary lifestyle, okay, or unhealthy diet, okay, eating a lot of processed food, okay, or processed sugars, okay, which has been actually the norm. People take a lot of processed sugars, okay, that one actually increases the risk of development of diabetes. The other thing that can increase the risk is age, okay. Now, here the issue is, as you age, the cells become unresponsive to the insulin. So the older you become, the increased it's a risk in itself of development of diabetes. And then the other risk is hypertension. So if you are hypertensive, okay, there is an increased chance of you developing diabetes. So diabetes and hypertension they are mostly a brother and they are sister diseases, okay. So, and then dyslipidemia, a lot of fats in your body, okay, mostly the low density lipoproteins. And then ethnicity, okay, diabetes has been shown to be more prone, especially in people of the African descent, okay. And then we have talked about gestational diabetes. So if you have had the gestational diabetes, okay, or diabetes during the time when you are pregnant, there is an increased chance of you developing diabetes, okay, later in life. So, how do you make a diagnosis of diabetes? So, there are several tests that we can do, okay, but of course, history very important, okay. How do patients present? So, we have talked about the history, and then now, how do patients present, okay, which we are going to look, and then the tests. Now, you can do what we call a fasting blood sugar, which is basically the blood sugar level you take, needle prick, okay, you take at least after 6 hours of fasting. Now, anything above 7.0 millimole per liter, that one is suggestive of diabetes, or a random blood sugar of more than 11.1 millimoles per liter, okay, with or without symptoms, okay, can suggest that you might be having, okay, diabetes. Okay. Now, for pregnant women, there is a test that we normally do, which is called oral glucose tolerance test. Okay. Now, if this test is done and your blood sugar is more than 11.1 millimoles per liter, it might be suggesting that you might be at risk or actually having diabetes. Now, the other test that we can do to basically confirm, like HbA1c. Now, HbA1c basically tells us how much your blood sugar has been for the last 3 months. Okay, so once you do that, okay, anything above 6.5% of HbA1c, or what called the glycosylated hemoglobin, is suggestive of diabetes. So, how do we do management? So, management number one is lifestyle. Okay, you need to take healthy diet. Okay, avoid processed foods. Okay, you need to try and do a lot of exercise and shed off that excessive weight that you have. Okay, reduce your BMI. Okay, because as you exercise, it makes also your cells to be more active, and you are able to they are more responsive to insulin. Okay, so weight management. And then for the people who smoke, okay, you need to stop smoking, because smoking basically is in itself a lifestyle factor that can actually contribute to diabetes. Okay, so for type 1 diabetes, treatment is a lifelong insulin therapy, because you are not able to produce insulin completely, and therefore you need insulin all through. Okay, and then for type 2, there are some drugs that you can be given to help increase the sensitivity of the cells to the insulin that you produce. Okay, a drug like metformin and other oral glucose agents. Okay, but also when it reaches a point where even the insulin is still not enough, now you will insulin might be introduced. Okay, now, and then the other thing is you need to monitor your blood glucose. So you can have that machine at home, okay, the machine where you can actually monitor your blood glucose. But also there is this test that we have talked about, the HbA1c, that basically helps to look at how your blood sugar has been controlled for the last 3 months. Okay, and also screening for complications is very important, and we are going to look at those complications very soon as we continue. So, what are some of the complications? So, we have the acute complications and we have the chronic complications. So, acute complications, there is a complication, are mostly 3. Okay, so diabetic ketoacidosis, hyposmolar hyperglycemic state, and hypoglycemia. Now, these are complications that I'll do a separate video on each of them, so that we are able to discuss them in details. And then for the chronic complications, number one, you can have complications that are affecting your eyes, what we call retinopathy, leading to blindness. Okay, you can have complications, and that's why you have had people talking about diabetic retinopathy or glaucoma or anything of that kind. And then the second complication is when you have a problem when they affect the kidneys, what we call nephropathy, and that one can actually lead to chronic kidney disease. Okay, and then neuropathy. You've had people complaining about chronic tingling and loss of sensation, whereby someone tells you that I don't feel my leg, okay, or some tingling sensation. That is neuropathy. Okay, and then we have what we call the macrovascular complications. So with macrovascular complications, these are complications that are affecting the big vessels. Okay, so the retinopathy, neuropathy, and nephropathy are complications affecting the small vessels in the eyes, in the kidneys, as well as the nerves. And then macrovascular affects the big vessels. Okay, so it can affect the heart, whereby you end up with cardiovascular disease or even stroke, especially in the brain, or peripheral artery disease. And other complications include, number one, diabetic foot. So basically those chronic ulcers that we've talked about that are not healing, okay? And that can actually lead to infection. So if that ulcer is infected, it can actually lead to gangrene, whereby the whole of that part basically dies, and basically it can end up into amputation. So how do we prevent? Number one, we have talked about this, healthy diet. Okay, so you need to take a balanced diet. Okay, avoid a lot of processed foods. Okay, you also need to manage your weight very well. So avoid sedentary lifestyle. Do a good exercise that will be able to help make you more physically fit. Okay, number 3 is avoid smoking and avoid alcohol intake. And then, of course, regular screening is very important. It's good to just walk into the hospital and just know how has been your blood pressure been, your blood sugar been for the last 3 months. Okay, you can do that test and it can actually help for early detection and for prompt treatment that will be able to help prevent complications. Now, if you're new here, please consider subscribing to our YouTube channel. And especially if this information has been very helpful to you, please follow us on YouTube, follow us on Instagram, follow us on Facebook, and also follow me on TikTok, and so that you're able to get this information every time we upload a new video. Now, if you have had any of these complications or your loved one has had any of these signs and symptoms, please don't hesitate to call us. Don't hesitate to visit us at Zawadi Premier Hospital. We are located at Lucille Center, which is along Gong Road, okay, actually in Gong, okay, opposite Juanco Metro Station, and we will be able to help you. Until next time, God bless.